Cool. So we're here. My name's Georgia and...
I'm Kay.
And Kay is not Olivia. You
I am
will
not.
notice we've got a guest. We've got our very first guest today.
Am I the first?
Yes, you are. How do you feel? How do you feel?
I'm honoured. Honoured to be included. Sad Olivia had to be dying for this to happen. But it's fine.
Well, that leads us to our next point of business, is that Olivia currently has the spicy cough, the cove. Unfortunately, rest in peace, Olivia.
R.I.P.
For the time being. So she threw this curveball at me like yesterday and she was presenting. So she's going to present Graham Stephen Reeves, and he's apparently known as the Butcher of Bega, and that's all I know. But that was,
Sure.
I know, slay. That was recommended to us by one of our Nursing Nightmare Fuel writer-inners.
Messages?
Emailers? Whatever. She wrote in and recommended Graham Stephen Reeves, so we're going to do that next week. But for this week, I had to come up with something. So today, before I announce what we're doing, tell us what you do, Kay. Tell us about yourself.
From when? Sorry, I was born? No. Fateful day in the 90s? No.
It all started when I was born.
No, so I am an emergency department nurse. Actually really enjoy what I do. Mm-hmm. Love my department, love my people.
Awesome.
There's always that one person, but no, I really enjoy what I do.
Or two people.
Or 10, it's fine.
Or
It's a
3,
big department.
or 5.
No, so I started studying in 2020. So I moved to Melbourne in 2020.
You were a COVID nurse.
I was a COVID nursing student. So
how was that?
Look, publicly I have no opinions.
Fair enough too.
So yeah, moved to Melbourne in Feb 2020. Super fun time to move here. Started nursing school. Did my degree. Got through it. It's fine. Did my placements.
Yeah.
Then started my grad rotation.
Yeah.
Did 5 months on the ward, 6 months in ED. Really liked it.
Yeah.
Hung around, did a TSP, and here I still am.
What's a TSP?
Transition to specialty practice.
Of course.
So not a postgrad, but like sort of a halfway between, just like a coming out of my grad year, going to work in a specialty area. Here's some extra love and education. It was a 6-month program, really well supported.
Nice.
Loved what I did.
Beautiful.
Yeah.
Fun story. I tried to do a TSP after my grad year. I did 6 months in anaesthetics, 6 months scrub scout in the peri-op department. And then because of bullying, I left that place and I wanted to transition into ED. Because that's where I wanted to be from the start. But the hours just didn't work for me as a single parent in my grad year. No. And so I went to the Northern and did a interview, and they told me I didn't have enough experience to do the transition to specialty practice course.
Sure.
It's like, I've just spent 6 months intubating people, or helping, at least.
Where do they want you to get the experience to do a transition to specialty practice?
I mean, if I didn't answer your clinical questions correctly, I'm sorry. I was fucking nervous and beat down from the horrible 12 months I just had. Please build me back up again. But no.
No, that'd be
They were
nice.
like, come back when you've got more experience. I was like, fuck that. I'm going into agency nursing and I've haven't looked back.
Fair.
I've never gone into ED, except I did do 3 months in an urgent care. And I actually did quite well. They told me that I was really good at assessment. So I thought, slay. But then I got fired for my TikToks. So
TikToks every time.
That went kaput, but what can you do?
What can you do?
Anyway, so on that note about ED stuff, what we're going to do today is read off some Reddit horror stories from the emergency department. So this is going to be really, really fun.
I'm excited.
Okay, so let's get into...
I'm so excited.
Let's go. I've just texted them all to myself because I was doing it on my other phone that has the Reddit app. Anyway, hey, what's up?
Me?
Yeah.
My pizza's tiny. It's like small.
Oh, really?
Yeah, it's smaller than mine.
Uh-oh. Oh, no.
Oh, no.
Mine's like this size.
Oh, okay. Well, maybe you guys can share. Sorry, Hunter. I must have selected the wrong size when I was ordering, honey. Are you all right? Sorry. My bad.
Heaven forbid they have to share.
Yeah. Oh, my God. It's just, it's rough out there being a kid. getting pizza for
When
dinner
I was
and
their
shit.
age, my sister and I had to share a pizza, probably about the size Hunter's is. So
Yeah, absolutely.
we
When I
didn't
was
get
a
our own
kid, we were
pizzas.
lucky to get fast food ever.
right,
Ever. It was
it wasn't until I was old enough to have a part-time job
Yeah.
that we got fast food because I would buy it with my
own money.
yeah.
Brutal.
So I worked at Coles at 14. And
It was
do that.
meat and 3 veg all the way for me
yeah,
and
absolutely.
my single mum with 4 kids household.
Single mom of 2 kids. Yeah, same.
Yep. All right. So this one, so some of them are from the emergency department. I have like focused around ED, but some of them are like paramedics as well. And then some random people writing in about, oh, I'm not a nurse, but my mum's a nurse, and this is the story she told me. Okay. All right. So let's go. This one's titled True EMS Horror Story. I worked as a dispatcher for a pretty small ambulance station near a fairly large city in the middle of the US. Oh, most of these are from the US too. So I don't know how specific I can be since this is a true story, and I'm going to tell one of the craziest stories I have from this job. We had a patient who we will call Susan. She was a dialysis patient, and one of the services we offered was to take very unwell or disabled patients to and from the dialysis appointments. She lived with her son, who we will call David. He was in his late 40s and his mother Susan in her late 70s also. Every week, like clockwork, we would have a unit bring Susan to and from her dialysis treatments 3 times a week. Everyone knew her at the station because we had been doing this for quite some time with Susan. We were all familiar with her and her son, whether it was the crew seeing her in person or taking care of her, or speaking to her or her son on the phone frequently about the appointments as I had done. Naturally, when crews had news about her health, they would report back to keep everyone in the loop with how she was. At one point, she was not feeling well at all, but she wanted to go to her dialysis appointment, so naturally we obliged and took her in. At this appointment, while receiving dialysis treatment, she lost consciousness and was promptly taken by our crew to the hospital. When it was time again for her dialysis appointment, we gave the hospital a call to see if she had been released and was able to go to the appointment. The hospital staff informed us that she would likely be released the following day and would be receiving that dialysis treatment in the hospital. The next treatment time rolled around, and we called the hospital and we were told she had been released from their care the other day. This was great news, but a little strange due to the fact that we were always her first call to transport her to or from any hospital or appointment, and we hadn't transported her anywhere. We quickly moved on, however, and called David, her son, to see if she was going to be requiring us for her treatment that day. He informed us she wasn't feeling well and that she wasn't up to it, but he was considering taking her back to the hospital. We tell him that if he needs us to just give us a call, and until further notice, we cancelled her trip for the day. We never get a call. Next appointment rolls around and we call David again to ask if she will be going. He says she's sick and she's going back to hospital. Weird. Again, since we hadn't taken her, but she didn't seem that off considering her health had been deteriorating. Next appointment, same thing happens. We call David. His mum's in the hospital, we move on. Now is where things took a bit of a turn. When the next appointment came up, we had tried calling David to ask about his mother's status, but he never answered or returned our calls. So being that we had a contract with Susan and were to take her to these appointments unless told otherwise, we sent a crew to collect her for treatment. When the crew arrived at scene, they knocked on the door to no response. They knocked again and were greeted by David smoking a cigarette.
You're doing great, babes.
David seemed surprised. The crew said they were there to pick up Susan for her appointment. David responded stating he had forgotten to call, but Susan was still in the hospital and not doing well. The crew gave their best wishes and David shut the door, but the crew felt like something was off. They immediately radioed to dispatch that something was wrong and they requested we call the hospital David said that she was at to see if she was still there. The hospital had no record of her being there since last we knew. So we had the crew leave the scene and we called for a welfare check on Susan at her son's home. We heard nothing the rest of the day from the police. The next morning, I came into work and the very first call I took began with, "This is Sheriff Blank with blank department. I'm calling to report back on the welfare check you asked us to perform yesterday." I was nervous as he sounded concerned and I didn't really expect them to call us back with any news. He proceeded to let me know that upon arrival to the home, they spoke with David, who was adamant his mother didn't feel well, but that she was home from the hospital. The police asked to just check on Susan to make sure she was all right, and eventually David obliged, letting the police in. Once entering the home, they were met with a grim scene, though I imagine they smelled it first.
Oh, God.
Dun, dun, dun. They continued to explain that what the officers observed was the dead body of Susan propped up on the couch, wrapped in blankets, as if watching the television.
Oh my God.
But she had been dead for a while. They approximated around 2 weeks. When speaking to David, they found that he had been changing her clothes regularly and watching TV with her. Obviously, he was suffering from some sort of mental issue and grief, but the thing was, he had never taken good care of her until she was dead. No news coverage, no updates from the police further than that, nothing. Stuff like this happens in your hometown and you never know. Crazy, right?
That's wild.
Isn't that insane?
That's wild.
God bless EMS.
Sitting there with a dead body for 2 weeks?
Yeah, man. Wouldn't that stink?
Surely.
Oh,
I've met alive bodies that smell bad.
Yeah, me too.
I can't imagine what the dead ones smell like.
I second that notion. It's crazy. One comment says, as a dialysis tech, I find that the transportation knows more about our patients' lives and status than we do. They are the first to call us about a report, fall, or hospital visit over the patients informing us, which is true.
Yeah, it would be.
Oh my God,
That's
crazy.
sad, though.
So sad. Did he just let her go without dialysis for like days and days out of neglect and then
it's just wild. Like, did she pass because she was genuinely so unwell?
Yeah,
or
probably.
Did she just miss
like
a couple of days?
3 appointments. So she probably died of kidney-related issues. Yeah.
Kidneys, but does that not?
Well, they've already clearly packed it in already,
Right.
but like
needing dialysis 3 times a week. Fuck.
yeah. Oh, poor lady.
I'm
poor
glad
Susan.
the EMS were checking in on her though.
Yeah.
Like,
but how
they're worried.
traumatizing for poor guys.
The poor sheriff had to rock up and like
Yeah, I know.
deal with the body.
True, but that's kind of what they do, isn't it?
Yeah.
Not that makes it any better, I guess. All right. So someone on Reddit has posted and they've said, what is your ER horror story? And so these are like the comments in that question, right?
All right.
So this one is from Villa Sock. 9 years ago this was. Okay. I got swine flu vaccine and nearly died. Went into a new gyno that was just one of those hospital-employed doctors that happened to be covered by my insurance at the time. I was busy working 2 jobs, and my regular gyno had passed away from plastic surgery complications. What the fuck? That's unfortunate. So I went with the appointment I could get. Anyways, he randomly offered me the swine flu vaccine. He did the little your insurance covers it dance and threw confetti at me, so I really couldn't say no. This was in the early afternoon. By 6 in the evening, I had this pounding headache that wouldn't go away, and within 30 minutes of that, it had spread to my neck. Within the hour, I was in so much pain that I couldn't move my neck, and my parents had to come pick me up and bring me to the ER. I was in so much pain for an ambulance, the bumps jolting up my neck from the wheels on the asphalt in the road were the most painful thing I had experienced until then in my life. Are you clocking what he has? Yeah. Mm-hmm. I thought this is classic meningitis. I love that he knows.
I'm so glad he knows.
He must
my
be
brain immediately, as soon as like, I had a headache that moved to my neck. So,
dun, dun, dun.
Where's the rash?
Yeah. I can't believe I didn't get vaccinated. What?
We're vaccinated for the swine flu, but not meningitis?
Can you get vaccinated for meningitis?
I don't know if you can.
Oh, yeah, that's news to me if you can. Anyway, moving on. It's not like we're nurses or anything. Anyway, by the time I got there, my brain literally, I'll explain later, was so swollen that I was getting nausea, waves, and screaming at the top of my lungs in pain. I puked until I was dry, heaving for an hour. Oh, and I was still in the waiting room. My body was on fire. I honestly knew I would not survive the night, and it was sad to see my family helplessly watch me shake in pain. The nurse asked me to stop screaming. Standard. Can you die a little quieter, please?
Disturbing the other waiting room patients.
There's other people in the waiting room. Thank you. She was a jerk and it made me cry to talk about it still, so I move on. Aw. They maxed me out on morphine. Nothing. Maxed me on Dilaudid next, which I think is like hydromorphine, like a stronger version.
Fair.
It helped slow my movements down from the adrenaline, so ultimately helped to stay still, and then came the spinal tap. I was so dehydrated and my spinal cord was so swollen at this point that it took 30 to 40 minutes to get enough fluid for a spinal tap. Brutal. And they still didn't have as much as the nurse wanted by the time it was over. You try having a needle jammed next to your swollen spine for half an hour when you are literally about to die from pain. I still get phantom pains in my spine from whatever jerk nurse did to me. Nothing. It wasn't meningitis.
Ooh.
They had literally no explanation. They just knew everything was swelling and couldn't do anything but watch. From what I understand, this is the worst pain a human body can be in. All the pain receptors are firing at once. Here is the miracle. I have severe asthma, so I had been on a course of oral steroids combined with my everyday inhaled steroid. This is the only thing that saved my life. This counteracted the swelling of my CNS. This is so science, but man, am I thankful for prednisone now. I don't know what the science means. No. Is that like woo-woo? I don't know. Anyway, moving on. They kept giving me meds to calm me down, and I was finally so fried from the adrenaline and stress that I passed out for nearly a day. I woke up heaving and did so for the next 2 weeks on my parents' couch while my mum watched over me vigilantly. I visited the local urgent care clinic 3 times for fluids. I had random anxiety attacks for over a year after that must have been spurred by the damage the swelling did. I was nauseous for, I am not even exaggerating, 6 months straight afterwards. I still get bouts of nausea and shakiness for 2-3 days at a time, sometimes once a month, and sometimes it can be 6 months between. And I have a little bit of memory loss from random times, but new memories are good to go. The only thing I did differently that day was get the swine flu vaccine. The nurses never tried to figure out what it was, nor did they write the cause I gave them. I said it was probably the vaccine. I'm guessing it went unreported, like many of these cases do. I was never contacted by a doctor after the fact or given any information on how to heal or what I should look out for. It was, by a miracle, I survived full-fledged encephalitis from a vaccine reaction, and that I survived the horrible aftermath. I had to move in with my parents, quit one job, and couldn't drive for 6 months. I was a little shaky and my depth perception was off. Moral of the story is, if you get a vaccine and you get a headache soon after, go to the emergency room immediately and tell them. Don't suggest. Tell them it is most likely a vaccine reaction. Hopefully they can get a spinal tap done in a reasonable amount of time and perhaps get steroids in someone faster than they did anything for me and prevent someone from so much permanent nervous system damage. Doing research on this made me realise how deadly my situation really was and how lucky I am to have a family I can count on. Wow, what
That's
a story.
A rough one.
Such a rough story.
Man, I get a headache every time I get my flu vaccine. I'm not going to the ER every time.
Do you?
Yeah.
But that's like a common side effect.
Exactly.
Isn't it?
But
like,
still.
That would make sense for it to be an allergic reaction. It's not necessarily the vaccine doing that.
No.
Just as a disclaimer, everyone. We're not anti-vaxxers. We're very pro-vax.
Have had my flu vax this year.
Good girl.
I mean, we are in June, so would expect I should have done it by now.
Yeah.
Although,
well, I'm yet to do mine.
I was also away for a month. It's fine.
Yeah.
Got it when I was on an agency shift in a random surgical suite.
Oh, nice. I think I did that last year.
They just came around. They're like, do you want your flu vax? Like, oh, I'm agency. Like, it's fine. I'll get it somewhere else. Like, no, you're here. We'll do it.
Oh, that's good.
Well, this was
yeah,
so
because
good.
they just take your details and put it on the Medicare register or whatever. Let's have a look at the comments. Oh, naturally there are a bunch of anti-vaxxers in these comments.
There would be. It's also America.
One person's like, yeah, people are adamant the vaccines are safe. The original poster says, I'm not saying vaccines aren't good for the general population. My degree is actually in biotech. I knew they were healthcare. But I think the panic that surrounds outbreaks like the swine flu can lead to the quick development of medications and vaccines that may do more harm than they do good. Is this before? 9 years ago. This is before COVID?
That was well before COVID. And we had
Crazy.
literally that.
Well, that was a wild story. I'm glad they're okay.
Yeah. Lives to tell the tale.
Let's go and find some emergency department ones now.
Please.
Okay.
I need some ED drama.
ER nurses, tell us your horror stories of triaging.
Let's go.
Let's go. Do you triage?
I do not. At my hospital, only critical care registered nurses, so CCRNs, who've done a postgrad triage, which is great because I don't want that responsibility. I don't want to be responsible for when a person gets a bed and when gets seen, and no thank you.
Apparently it's hell.
I work the waiting room, so I see what they do. I deal with I see the drama. I don't want to be responsible for it.
Yeah, fair enough too. All right, ER nurses, tell us your horror stories of triaging. Triaging last week, male patient came in, pale, sweaty, complained of pressure on his lower neck and chest tightness. Immediately seen for an ECG, shows heart attack. As I start the paperwork, labs, etc., woman comes up to the front desk screeching about how she was here before the guy and should have been seen first. Her chest cold is so bad. My reaction, okay. We will see you as soon as we can, ma'am. She's yelling, getting up in my face. Says she's leaving. Eyebrow raised. Okay, you are certainly free to do so, ma'am. She starts saying she will say she can't breathe and is having chest pain if she gets seen faster. Eyebrows creeping higher and higher as her tantrum progresses. Okay, ma'am. She comes back 3 times to complain to me about the other patient being seen first. Okay, ma'am, I thought you were leaving. Are you leaving? Kicker. She's leaving and making an appointment with her family doctor, all for the chest cold. The circus of humanity never fails to astonish and amuse. Share your tales.
Sounds great. It's what she should have done in the first place.
Yeah, I know.
Come to the ED for a chest
crazy.
cold.
Some people panic.
They do.
And they've got no education, so they just turn up.
My favourite statement is when someone says, I'm going to leave. I'm like, cool, this is not a prison.
Yeah.
Go whenever you want.
You are free to leave as you wish.
Exactly. Especially when they're still in the waiting room and have not been picked up by a doctor. I'm like, if you want to go for your life. If
Absolutely.
you feel safe and well enough, like obviously we do the whole, here's the red flags, come back and see us if you're worried.
Yeah.
But you are free to leave at any point.
At any point. In fact, we hope you leave right now.
I had 2
Please
Dharma
do.
forms signed last night. I'm not going to stop anybody if they want to leave.
Is that leaving against medical
Yes,
advice?
so discharge against medical advice, Dharma.
Is that because they've come into the back?
So once
And they've
treatment has been started, they have to sign the Dharma form.
And you can be treated in the waiting room, right?
You can.
Yeah.
Especially we night shift, weekend night shifts, we'll get bed blocked. So the wards are full. There are no beds.
Yep. So they'll
ED
just sit
cubicles are full. So people are in the waiting room.
Yep.
It sucks. It is a problem in
It
the
is what
healthcare
it is,
system,
though.
but it is what it is. And so, sometimes people are in the waiting room. Sometimes longer than my night shift, which is 10 hours. I feel for them. It is horrific. I give the best care I can in the
Wow.
waiting room. Doctors still see patients in the waiting room.
Yep.
We have assessment rooms, so they'll come back. They'll get
Yep.
ECGs. They'll get bloods.
No one's
get
unseen. They're just
scans.
waiting for hours for
Exactly.
beds. That's how it is.
But treatment gets started. We give meds. There are some meds we don't give in the waiting room because obviously we can't observe the patient as closely as we'd like. Or I have 50 people in the waiting room to one nurse.
Yeah, that's not safe.
It's not safe for us to be giving certain meds. It's fine. The doctors are well aware.
Yep.
We'll try and find them a bed if we can. But no, treatment starts in the waiting room.
Yeah. And that meds that you're referring to are like strong painkillers.
Strong
and things
painkillers.
Like that. Yeah.
We try not to have to give antibiotics, like IV antibiotics.
Yeah, because you
it
can
means
have a reaction.
Yes,
Yeah.
and it also means they take up an assessment room for an hour or two.
Yeah,
And so
right.
it's less people we can assess, unless it's obviously dire straits, in which case they'll probably go to resus to get those antibiotics if they need them that badly.
Totally. Makes a whole lot of sense.
Yeah.
So if you're coming to ED for a minor issue that you can go to the GP for, if it's pain related, obviously, like understandable. If you're in a bunch of pain, then come to the ED. Maybe they'll give you something, but you're not going to get anything strong in the waiting room, so just be aware of that. Moving on. So someone comments on this thread. I was an RN for several years prior to ICU grad school. Busy night, waiting room full, 23-year-old obese female comes in complaining of shortness of breath. Gets vitals. Tacky at 1:30, Sats of the 90s, no birth control, non-smoker. Bring her right back. Get flack from the charge nurse and attending for bringing back a non-urgent patient. She has a huge saddle embolism.
Ooh.
Do you know what that is? What is it? I don't even know.
Pulmonary or cardiac, does it say?
It just
I'm
says
assuming it's gonna be
saddle. Let's
pulmonary.
Google pulmonary embolism.
Yeah.
Oh, it's right between the two lungs.
So it sits on
The middle.
across both, so it's blocking
Okay,
both
so it
bronchioles
just
basically.
straddles. You're basically not getting any perfusion at all. Or,
Depending on how big it is, it
Yeah.
can block entirely.
A type of PA where a large blood clot gets lodged at the point where the main pulmonary artery branches into the left and right arteries. Insanity.
Blocks
How
blood
is
flow to
she
both lungs.
even walking?
You'd be surprised.
That's
People walk in with some
crazy.
unhinged stuff and you're like, how are you
How
conscious?
are you? Yeah. How are you conscious?
Sometimes. Oh
Oh my gosh. Okay. That's the end of that story. But that's crazy.
Good on that nurse for like advocating, escalating, getting her through.
Yeah, well, I mean, the signs are that she's desatting.
Yeah,
She's
on room air.
tacky. She's only 23.
Yeah, like she's young.
And she's got shortness of breath. Like, that's enough to get a fucking assessment, isn't it?
For sure.
Like,
That would be going to one of the doctors and being like, hey, little worried about this person. Come at least do a rapid on them. Mm-hmm. Do a rapid assessment at least.
yeah. Yep. All right, so this person has edited and added another story. Guy walks in with left-sided weakness, unequal smile, the works. About to roll to scanner and someone checks blood sugar because it's protocol. Blood sugar is unreadable. Push D50. I'm going to say that's dextrose. Patient blinks and looks right at me, confused as hell. Looks around and says, I forgot to eat breakfast again. Had no recollection of coming into the ER. Crazy.
Love diabetics that just like skip a meal.
Oh my God, they're
definitely-
terrifying though. Okay, so this one's from Wixer, who is an RN. Not ER triage, but OB triage. We got pretty much anyone who is 16 plus weeks pregnant that comes to the ER unless it's a trauma and they need to be cleared first. Story 1. Woman in her late 40s told the ER she was 20-something weeks pregnant and they sent her up with that question. Her whole family came up with her, including her grown children. I think she was complaining of spotting.
Wait, grandchildren at 40?
Grown.
Oh, okay. It's like grandchildren at 40? Sure. I'm not judging, but...
Unable to get the baby on the monitor, so the resident grabs the ultrasound. There is no baby. No signs of there being a baby in there recently. The resident tells her this and she breaks down sobbing, asking us to all pray for her and the baby. She refused to leave and asked us to induce her. It was bizarre.
Induce you for what?
I know, a phantom pregnancy. The family didn't seem shocked at all by this whole ordeal. It was so weird. We had to get security to escort her out because she wouldn't leave. Okay, 37-weeker shows up saying her waters broke. Ferning and nitrazine were negative. Don't know anything.
No.
Have no idea. No clue. Anyway, moving on. She keeps yelling at us, my water's broken. Then she stood up and said, see, I'll show you. She proceeded to piss herself in front of everyone.
That's not how that works.
Crazy.
No, in our ED, if someone comes in and they are pregnant and anything to do with birth, they go upstairs. They don't even get triaged. We rush them. We have the hot
Straight
lifts,
to
which go straight up to...
The hot lifts.
Called the hot lifts. They go from
Groovy.
ED to like theatre, ICU and CCU and birth suite. And we get in those hot lifts. They move fast.
Yep, and they're staff only, aren't they? ED
You got
staff.
to tap in there.
Yeah.
And we take that person straight up to the birth suite. We want nothing to do with babies.
Yeah, fair enough too.
Babies coming out, no, not an ED thing.
Unless they get born in ED on the way to the hot lifts.
Do you want to hear this story?
Yes.
Oh my gosh. So I'm coming off shift and I was actually a couple of minutes late. So I'm walking through the back of the hospital to go to ED and the power's out.
Uh-oh.
Generators will kick in.
Oh, okay.
Because sometimes it takes a minute or two. We're in the middle of getting handover. I'm working the waiting room this shift and generators haven't kicked in. We're like, what is going on? Then this dad comes running into triage and he's like,
God.
my wife is having a baby. One of the nurses goes out there and she's standing in the entryway to ED screaming, like birthing this baby.
Yep.
So we try to get her in a wheelchair, like couldn't sit.
There's no way in hell you can sit when you're birthing a baby. Impossible.
Fair.
I've done it twice.
I have not done it, but I'm not questioning that at all. We get around, generators are still out, so there's no electricity.
God.
We get around to resus.
And wait. Do you have like power slide doors to get into the ED? Like, how did you open the doors?
Thankfully, they were still working. I don't know how or why, but that was we could get him.
Let's not question it.
We're not questioning anything. We get around to resus. I've called the code pink. Someone else already called the code pink, so it's happened twice. And then I'm running around in all the assessment rooms trying to find a fucking torch. Find a torch where the batteries expired in 2005.
Number one priority, find the torch.
We had no power. There were no lights.
Yeah.
We're in the dark. We're not doing great. And by then, all of the doctors from night shift have come around. They've all got their iPhone torches. I'm standing at the back of resus like this with a torch.
Like, why the fuck didn't I think of an iPhone torch?
Well, our torch is like the big, massive, like industrial ones that are supposed to be good.
Yeah, gotcha.
Yeah. Anyway, and I kid you not, within 2 minutes of mum walking into the ED, baby was born.
Wow. Did you have any you probably got an OBG?
They didn't get down there in time.
The lifts weren't working.
No, they said to come down 3 flights of stairs.
Fucking hell. That's a story to tell at a 21st birthday.
Honestly, birthed the baby.
Oh, bless.
Yeah.
I bet she loved that.
She was actually telling this story last night as well, which is why it's like on the front of my mind. Last night, 2 nights ago.
If that was me, I would tell it every single day.
Honestly.
There's something so fucking special about birth.
It was pretty special, actually.
Was it a boy or a girl?
Screaming.
Did dad cut the cord? Was there a cord
I actually
cutting?
don't know. But then OB had arrived and I was like,
well.
you know what, there's too many people, too many cooks in the kitchen.
So you made a swift exit,
yeah,
did you?
My torch wasn't doing much anyway.
Oh my God, that's such a cute story.
Yeah.
I've been to many a cesarean section birth and it never gets old.
No, I can imagine.
The dad gets to come and sit near the mum's head. If it's an elective and everything's going to plan,
and there's no like super serious concerns.
Yep.
Dad gets to be there.
Anything untoward
or the other
happens,
parent.
they get kicked out. But the anaesthetic nurse often gets the role of taking pictures. Like they get the dad's phone and they get to take pictures. So I love that.
You just get there and just take pictures of the baby.
Yes, it's great. Love it.
But I don't know who did it, but my mother has photos because I'm a cesarean baby.
Oh, are you?
And there are photos of the cesarean and me being removed, which is, it's kind of special.
It is.
It's pretty special. And I like that we have those photos.
Women are amazing.
Women are amazing. Their bodies are amazing.
Legends. Next story.
I'm ready.
We've got a lot of butt stories. Also.
It's the ED.
because I had to.
I can tell you a
They're
couple
towards
too.
the end though. Okay. Oh, great. I can't wait.
I can participate in this.
All right, next one. Really busy night in the ED. I'm triaging. Our waiting room is bursting at the seams and there is over an hour and a half wait just for triage.
Wow.
Wow. A guy comes in with his family. His complaint is he just doesn't feel right. Really non-specific symptoms. Ob's all pretty normal, in his mid-40s, slightly overweight, no relevant history, no cardiac history or family with cardiac history. Happily talking and conversing, but just has this feeling that something isn't right. Denies chest
Sense
pain.
of impending doom.
Yes, nailed it. Denies chest pain, numbness, tingling, jaw pain, you name it. I just had this weird feeling about him, so I took him into resus and put him onto monitoring. I clearly remember him lying there kind of laughing, looking at me saying, "This is so over the top, I'm fine." I turned to talk to the doctor, who, thank God, happened to be there. At that exact moment, he goes into VF and is plain as day on the monitoring screen, textbook VF, which is ventricular fibrillation to anyone who's not healthcare. He's unconscious.
It's not good is what it is.
No, it's bad. He's unconscious, eyes roll back in his head and slipping off the side of the bed. The doctor yells out for help and jumps on his chest. I'm trying to get oxygen and bag him and get paddles on him all at the same time before help arrives and can just do the airway. Defib advises shock. We all stand back and the shock is delivered straight back to compressions. He literally comes around right then and there, a bit combative because he's hypoxic, pushing us away and yelling about where he is and what's happening. Moral: do not underestimate that feeling you get in your gut. If you think something is wrong, it is. And if you're wrong, who cares? And then the first comment is, impending doom is a hard feeling for patients to describe. Yep. But it's a thing.
It's a thing.
You definitely get it when you're about to have anaphylaxis. You get a sense of impending doom, they say. I have had anaphylaxis and I can't remember the impending doom, although I did feel off, but it was more of stomach pain.
Interesting.
I know. But other than that, I've never had a sense of impending doom because I've never had a life-threatening issue apart from that.
Good.
Yes.
We like that.
Oh, I did bleed out actually after my first kid.
Fair.
But I was a bit delirious because I had no fucking PPH, yep.
Postpartum
I was
hemorrhage
not
for those.
postpartum hemorrhage, yes.
Yeah, sorry.
I was not aware of how bad it was. I was a bit off.
They didn't tell you, or they told
No.
you and you were just not quite there.
I was sitting
'Cause
there
you
and
were-
I was just bleeding out my vagina into a bucket, and my mum was there, and she was like, "Someone going to do something about this." They were all focused on the kid because Hunter, his heart rate went down, and they were all like, "Oh God, we need to get him out." Blah blah blah. So they basically reefed him out with like a forceps and episiotomy.
Forceps, yeah.
Yeah, and in the process caused a huge tear in my vagina. Fun times.
Love that for you.
But it was like up further, so that I don't know.
didn't
I was
see it
pouring blood out my vagina, and they were all gathered around the baby.
And they just kind of forgot that
Yeah,
you're
like,
just there in the
yeah.
stirrups, just
it's
like,
just like typical patriarchy.
yeah.
It's like, don't give a fuck about the woman.
No,
We
it's all
only
about the
care
baby.
baby, and it's a boy too.
And so, because, yeah, it was a boy, so.
Anyway, my mum alerted them to the fact that I was hemorrhaging, and they were like, "Oh fuck, we should probably get
Probably
over
something about that.
one surgical operation, and I think 3 units
Yep.
of packed red blood cells later."
Bit of TXA,
I
probably.
looked like a ghost, but I was alive.
Hey, alive's good. We'll fix the ghostly.
And you know what was the most insulting thing or most embarrassing thing was that the anaesthetic nurse was this really hot young bloke, and I'm sitting there in stirrups with my vagina all mangled.
Piss and blood everywhere.
And he just sat next to my head and talked to me the whole time. And I'm like, "Can you please leave me alone? You're so hot."
Shut the fuck
But
up.
I feel like dead.
It's not the time. Read the room.
I was like, "Does he find me hot? Or am I just hypoxic?"
Hypoxic and exequinating.
Do you know what's really funny though? I gave birth in Shepparton Hospital, which is, less than average.
I don't know many things, but I know enough.
GBH is not. It has a massive catchment, and
It would, because there's not much else up there.
a lot of their people that come in are, motor vehicle accidents or farm accidents. So they know their shit, but I think the culture's shit because they didn't have a proper surgical gyno that worked there. But lucky for me, there was one that literally started that same day, and he was the one that
His first
fucking
day.
delivered Hunter and stitched me back up. So lucky for me.
Lucky for you.
Lucky
He picked
for
a
me.
good day to come.
He did, and I invited him to the christening because I was very thankful.
Did he go?
He did. His name was Ibi Manu. Shout out to you, Dr. Ibi Manu. It's an African
Thank you, Dr.
gentleman.
Ibi Manu.
He's got really cute kids too. Adorable. Anyway, we are
So sidetracked.
so sidetracked. Moving on. Imagine if you listen to this. I love you. Bye.
Just secretly following your journey.
That'd be so cool.
You weren't a nurse yet at the time, were you?
No, I wasn't. I went into nursing school a couple of years later. You can just tell that all of these are healthcare workers because they speak in abbreviations. They don't speak in fucking full sentences.
I don't think I've written a full sentence in a note in my life.
Can't be fucked writing a novel. Woman in t-shirt comes to the desk complaining of abdo pain. The clerk gets her into the computer and the patient says she needs to use the restroom before seeing the triage nurse. The person at the front desk, who's non-medical, doesn't think anything of it and tells her to come to the triage room when she's finished for assessment. Typically not a big deal, but several minutes later the triage nurse hears screaming and runs to the bathroom. This woman, who was apparently pregnant and knew she was pregnant and didn't think her belly pain could possibly be related to her pregnancy, delivered her 23-week baby in the toilet bowl of the public bathroom. Oh dear.
Oh dear.
Oh dear. I'm just coming back from my lunch break and hear all the screaming. The triage nurse is giving CPR to the baby. Mum is screaming and somehow we get them to a wheelchair and into the trauma room. There was also 20 plus people in the waiting room who witnessed this whole ordeal. No. This was the only day there were no complaints about the long wait times.
Good.
Valid. Oh,
glad everyone read the room. 23-weeker. Did it make it? Does
no,
it say?
I don't think so.
If you're pregnant and you have abdo pain, probably could be relevant. Probably worth mentioning. Probably get triaged before you go to the bathroom. Do they get clerked before they get triaged in the States? We triage first here. Or is that a my ED thing? No, I feel like every time I've been to the ED as a patient.
I've been to the ED once in the States and I got triaged, I think, and then clerked.
Maybe
they came around with the computer and was like, do you have insurance? I said, I've got travel insurance.
Yeah.
Yep, so that covered my healthcare costs.
That's good.
I read somewhere that the baby had died. It was only 23 weeks, but I can't find it here, which is annoying. Yeah.
What's like is it 26 that's like the cutoff of will most likely probably make it?
Yeah.
I think. I don't know. I don't know. Anyway. I didn't do maternity.
I cannot clarify as to whether the baby lived or died, but I have a feeling they did not.
Yeah.
Rest in peace, little one.
23 weeks is a smidge early.
It is a smidge. Righto. Triaging a 12-year-old boy that mum brought in after school for headaches and generally feeling like crap. He has low-grade fever and endorses a sore throat. No nuchal rigidity or anything else that appears meningeal. Appears non-toxic. Absolutely. The child is non-toxic. What? Anyway, moving on. Absolutely no other findings that seem out of whack. Do a strep swab and it comes back positive and he takes a seat. 2 hours later, he heads back to the room, rather uneventful. A few hours after that, one of the nurses comes out to triage and asks me if I always keep 12-year-olds with head bleeds in the waiting room for so long. Apparently, the ED doc did a soft tissue neck CT because he was concerned about an abscess. Turns out, the top of the scan caught an AVM that was hemorrhaging. A combination of dumb luck and strep throat saved this kid's life. AVM, I think that's
it's not a good thing.
A fucking aneurysm.
Yes.
Let me just double check. Atriovenous malformation is an abnormal tangle of blood vessels that directly connects arteries and veins, bypassing capillaries.
And if they bleed, it's bad.
So it's like a cluster of blood vessels that just like burst. Kind of like an aneurysm.
Yeah.
Crazy.
Wild.
So they scanned him because they were concerned for an abscess or meningitis and they found a fucking bleed. Crazy. Lucky.
Glad it was caught.
Yeah, same.
Because they're one of those things that, like, when it bursts, that's it.
It just teaches you to be thorough. Any kind of headache, just do a scan.
Honestly.
You know? Not a triage nurse, but the nurse that was affected by this story. Guy comes in for medication refill, acting funky in the lobby. My preceptor was the triage nurse. She decided to put him in the BH area. Any ideas?
None. BH.
Brain health?
Behavioural?
Oh, yeah, maybe. Even though he was just a medication refill. I broke someone for lunch, went into his room to talk to him about his medication. He ended up attacking me and breaking the bed. Thank Jesus she put him in BH because there was security there. It might be the mental health
Must be.
place. Yep. And at least 4 other employees right there. I ended up with bruised ribs and arms and tension migraines. If she had put him elsewhere and he attacked me or someone else, there likely would have been more damage. And I took over for someone who was maybe 100 pounds soaking wet. If he had attacked her, he probably would have hurt her more since I'm bigger than her. Crazy. Fucking
That's rough.
Do not attack healthcare workers. If you're having a bad day, imagine how many people the nurse has seen having a bad day.
Right. And I mean this in the nicest way possible, but your worst day of your life might be right then in this moment, but it is not the worst day happening in the ED or in the hospital.
No.
There are people, like, dying.
Yeah.
And
Legitimately.
I know you are having the worst day of your life because you have,
Yep.
whatever, or you're having the worst pain ever.
Yep.
Don't take it out on us.
Yep. Please don't. But it could have been a psychosis. You don't really know. So
Especially
that
depending on what his
muddies the
medication
water a
was
little
that he
bit.
was- yeah.
Yep. Yeah. If he needs a refill, it could be his antipsychotic.
Yeah.
Could be anything.
And that's why I try not to judge. Like, some people are very harsh, like, oh, I'm looking after another psych patient. But, like, they're just here for help
Yeah.
and some love and support.
Yeah, totally.
And judging them and having opinions on them before you've met them.
Or assess them.
Assess them. Yeah.
Yeah.
And, like, when you give handover and someone says to you, like, oh, so this patient was so behavioral today, like, good luck. You're just putting in in the person
Yeah.
you're handing over to brain.
Yeah, your
bad
bias.
vibes and opinions and your
Yeah.
bias. Yeah.
People like that shouldn't be in healthcare.
No.
Or they're
Or-
at least burnt out and need to take a break.
Yes. Or maybe try a different area of healthcare if, looking after mental health and psych patients is
it's
not
not
for
your
you.
jam. Why don't you try dermatology?
Orthopedics.
like on Grey's Anatomy when they go to the dermatology unit and it's all pink and peaceful
And
and,
just
like a day spa.
And they were getting skincare and massages.
Yes. Hand massages. Love it.
I wish.
Oh, me too. Okay, Punk Ben, RN. Depends on the week. I have a million triage stories. The one that pissed me off the most was the GI doctor whose wife had slipped and broken her ankle. He came through the back entrance and just brought her into the triage office. No
fuck's sake.
registration, no acknowledging staff. He gave me a hello in the most obnoxious way possible. I told him to wait a minute. He barked something snarky, so I chatted with him. I told him he needs to be registered and he got more upset. His wife was already really nice and looked embarrassed. The whole triage, he interrupted me. Why isn't her leg elevated? Where is the ice? Can she get something for the pain? Can we just go to the room? Why haven't you splintered yet? Just constant bullshit. Ironically, all the interruptions made it that much longer to do any of that. Finally done and brought her to the room, he stood in the way, yet criticised how I transfer her. At the end, I came back to triage, where a very polite COPDer was waiting patiently, short of breath, out of meds, room air, sat, mid-80s. I was livid. Just another night in triage. Nellie's barking, 1 second.
Just Nelly needs some love. I got left alone and could say so many unhinged things, but I'll behave myself. You're back.
I'm back.
The entitlement of doctors never ceases to amaze me. Have you ever had anyone go in through the back door in ED?
I did once. But not on purpose.
But that's to like start your shift. Not to get medical treatment.
No, I got triaged at an x-ray.
Oh.
I rolled my ankle and I went to see my physio and she put me in a boot. She's like, you should probably get an x-ray in a week if it's still bothering you. So I went into work through the back way to go talk to my boss and be like, hey, need a week off. Here's my medical certificate. Can't work in my moon boot. And saw one of the radiologists while I was there and he was like, you should get an x-ray. Do you want to get it while you're here? I was like, no, it's fine. He's like, no, go get triage. I'll x-ray you.
Oh, cute.
So yeah.
But you went through triage.
I did go back
The
round to
end.
triage.
Period.
I waited in line.
Yeah, there you
Because there were
go.
some people. I got triaged.
Yep.
Then I walked my way down to fast track, but then instead of waiting in the fast track waiting room, I just went in. I just chatted with whoever was there. I was like, I'll wait my turn, but in here behind the desk where I
Yeah.
can chat to my friends.
Perks of the job.
Yeah.
Next story. Southern Stranger says, nurse here. As all emergency staff know, nothing gets accidentally stuck up your butt. We have officially entered the butt stuck era.
Here we go.
Foreign bodies in butts. Fucking hold on to your asses and strap in. Anyway, despite this complaint being quite regular, one of my most memorable presentations involved a gentleman who had a beer bottle stuck there, impressively, with the large end first. The situation was memorable due to the unique nature of how the bottle became mysteriously stuck. The man had gotten locked out of his house naked, attempted to climb back into his kitchen window, fallen into the sink, and the beer bottle somehow just got stuck with the flat side first.
Absolutely. It's definitely
Makes
how that
sense.
happened.
Totally. It's just standing on its tip, just waiting to be sucked into an orifice. Makes sense. I have come to appreciate the people who show up have lost all care factor for dignity and just admit, yeah, so I was fucking myself with insert random object here and I can't get it out. Often this person has attempted for many hours or a day or so to remove the object.
We're not here to pass judgment. Just fucking
We're
tell us how
not.
it got there, okay?
Yeah, please just be
And tell
honest.
us what it is, because it's easier to get out or work out how we're going to get it out when we know what it is.
100%.
We're not passing judgment. I don't care what you do in your spare time.
Oh my God, the comments. Hilarious. This person says, there used to be a frequent flyer at your place of business back many years ago who memorably presented with a butternut pumpkin in situ. Wild times.
Those things are fucking hefty.
They're the ones that sort of elongated.
Yeah.
They're not the round ones. So I
But
mean,
even like at the
that's
narrow end, it's
impressive.
still quite fucking wide.
That's impressive.
Mad respect.
I know. You'd have to get a fuck ton of lube on that to get that up there, though. All right.
The amount of men that are embarrassed by it. Like, your pleasure center's up there, my dude. Like,
Yeah, we get it. But just use something with a flanged base, guys.
Please.
Be smart.
because then it doesn't get sucked up there and you can
Exactly.
just yank it out yourself and then you don't have to come in and
Anything
see me.
with a flanged base. I don't recommend a wine glass because glass.
Yeah, don't use anything that can shatter.
Yeah, please don't do that.
There's a lot of muscles in there. They'll break it.
Oh my God. This person says, my wife has a doctor friend that we see a few times a year and he always updates us on the most ridiculous butt stuff stories. Last time we saw him, he told us about the guy who had a light bulb up there. Mm-hmm. Someone says, I see your light bulb and I raise you a mango. Oh my God. Jesus Christ. People, flange base, once again. Okay. Juja P says, once had a patient come in for foreign object in rectum. Not uncommon, but still weird. At least he didn't tell us that he fell on it. The story was the guy and his girlfriend were getting a little frisky and decided, let's shove a beer bottle up my ass. Again, another beer bottle. The rectum is a very interesting organ because it's made to expel contents and yet it is very good at pulling objects into it. Intuition dictated that the bottle could go in neck first. However, this created a vacuum and by pulling the bottle at the base, even if you have a good grip, you risk a prolapsed anus in the aftermath. So you're left to hopelessly let your ass eat the bottle. So they went to the local ED, clearly panicked. The ED doctors considered their options, which were all too dangerous, and figured it was best to leave it to the on-call surgeon to figure it out. Patient gets packaged up for surgery, taken up to the OR, and while on the table, the doctors infuse a knockout medication for what will be an invasive procedure. This particular med is also a muscle relaxant, so once it was infused, a few seconds later, sound of bottle rattling on the floor in brackets.
At least they didn't have to actually perform surgery.
Yeah.
Knock him out,
Just
relax all his
administer a
muscles.
muscle relaxant and it'll just shoot out if it's in the rectum anyway.
Yeah, it's still in
but
the rectum.
sometimes
It's
it
gone
gets
somewhere else.
sucked up into your intestines, like legitimately.
I've seen x-rays.
Have you? Is that on Instagram?
No, in our ED.
Because there's an Instagram channel. I can't remember which one it is, but there's an Instagram page dedicated solely to x-ray pictures of people having foreign bodies in their fucking intestines. And some of them are so funny. I saw a Buzz Lightyear up there once and it was hilarious. And they do a poll. They're like, guess
what
the
it is.
object.
Yeah. Could you tell it was Buzz Lightyear?
Yes.
Were his wings out?
Yes, his wings were out. We don't actually know if they had a perforated bowel or not, but I wouldn't be surprised.
No, me neither.
That's crazy. So this one is share your funny ER stories, make my miserable morning better. As the title says, we all know anything can happen in ER and especially the waiting room. Currently, I have one man who keeps playing very loud Christian prayer music, another who keeps running up to the window, updating their injury with the same info as each extra new patient who comes in, and I'm confident the only cubicle is being used by a chronic masturbator. If you can guess which hospital I'm currently in, I'll give you one free upvote and maybe a Subway cookie. So we'll go into these comments now. This is Dr. Zoidberg Jesus. A lot of people break out rectal foreign bodies for this. I have a twist on that. Guy comes in one night saying he's had a 4-inch narrow vibrator in his rectum for 2 days. Not his first rodeo. Describes it to me. Friend is with him. She confirms he's been trying to get it out. Fine. Guy refuses any sedation.
Why?
Why do you think? Just ponder that for a minute and I'll continue. As me and the nurse are doing this, I'm mid-forearm deep and he's telling me I'm doing a good job to keep going.
No, that's when you just
That's when you just remove your arm and walk away. His friend is holding his hand. The nurse is questioning her life decisions.
I would be too.
Yeah, I can't reach it.
Why was the nurse elbow deep? Why was the doctor not elbow deep?
Maybe they were both elbow deep at once.
Maybe.
He was like, that's good, keep going. They do an x-ray to see what's there, and the read says it appears there's a foreign body in the descending colon. I call in the surgeon. We go in together, and he's elbow deep in this guy. Also, still, no sedation. Surgeon thinks maybe he can touch it, but can't quite grab it. Eventually, we stop and order a CT, which shows no foreign bodies at all.
For fuck's sake.
Me. There's no vibrator there on the CT. Him. Well, that's good news. Me. Sir, I'm going to need you to leave.
Wow.
So they must have been touching a clump of hard shit.
Must have been. The surgeon
I'm
is
gonna
elbow
leave,
deep.
you
Like,
leave, and I'm going to leave shortly after. I'm just going to quit my job at this point.
I'm done. Like, you will not catch me elbow deep in anyone's rectum.
Nah, I'll just be like, I'm good. I'm underqualified. Okay, this is Shalem. Medics were called on a possible overdose in a come and go bathroom, spelt K-U-M and go. I don't know what that is, but it doesn't sound kosher whatsoever.
Won't catch me in one of them.
Gave him Narcan en route and he woke up fighting. He beat up medics and they had to call police. When he got to us in handcuffs, we transferred him into our 4-point restraint bed, undressed him and all that. When we went to straight cath him, we found he was wearing a chastity thing around his penis and it was locked around the waist. An hour later, we turned him and a huge dildo popped out of his anus. The dude was still trying to fight. He was also puking and throwing his vomit at us. Great day.
Sounds great. Typical day in the ED.
You just can't make this shit up.
You really
just
can't.
typical day, though.
And unfortunately, like, I fully believe it.
Yeah, I believe it too.
fully believe that story.
Lucky it popped out.
Yeah.
It must
Glad
have
no one
had
had
a
to go digging.
flanged base.
Must have.
Imagine.
He might have been high, but at least he was doing it
throwing
properly.
your vomit at someone.
I can't
That's
think
why
of
we wear
anything worse.
eyewear all the time.
No, literally.
Yep.
Throwing anything at healthcare workers, like, stop.
At this point, I was just reading through so many, like, foreign bodies and ass stories. So that's really what we're going to be reading at this point. Like, I just found them all hilarious. So I used to work in the ER sometimes, and when we would pull stuff out of people's buttholes, it would get washed and sterilized and put into this box under the triage desk.
Holding onto your trophies?
Yeah, what? When a new person started, we would run a pool on who would get the newbie to use something out of the box first. Can someone please call HR? Like, what? I won it once by taking the staples out of a stapler and then casually mentioning that, hey, there is a stapler in that box under the triage desk. Can you get it? I won $150 that day. And then one comment says, so someone crammed a stapler up their butt? I'm not sure how I feel about that. And then the next comment is, people cram everything in their butts.
They really do.
And then the next comment is, quote unquote, I fell on it. Imagine shoving a stapler up your ass. God, that would be so uncomfortable. Why do people do it? I'm so... Like, obviously for pleasure, but, like, whenever I've tried it, it just fucking hurts.
Well, because our pleasure centre is somewhere different.
Oh, true.
We don't need things up our asshole to get pleasure.
Valid.
Why do you think it's mostly men?
I just thought I was a man for a minute. I don't know. All right. So, not a nurse, but I'm a medical assistant. And once I had a patient that was a Catholic priest that developed a skin rash. He was treating it with that spray, Clorox clean-up solution, which, of course, only made it worse.
This is basically straight bleach, isn't it?
Yeah. When asked about the rash, he said he caught it from his wife and then pleaded with us not to report him to the head guy at his church since he's not supposed to be married. Obviously, we can't report things like that due to privacy laws. Turns out his wife was a hooker that was also one of our patients, unbeknownst to either of them. FYI, Clorox spray, when applied liberally and directly to your genitalia, will cause burns. What an idiot. He was like, if this is infectious, I'll just spray some fucking bleach on it. It's
Should have cleaned it with holy water. It would have been better.
Yeah. It's like in my big fat Greek wedding. Put some Windex on it.
Don't put bleach on your penis.
No.
Or anything else that's
Please
attached to your body for that matter. But
or your vulva, for that matter.
Any body
Don't
part.
do it. I once, this is totally off topic, but kind of on topic. When I was like 17, 18, I was helping my boyfriend clean his house because he was moving out. And I was cleaning the air conditioner vents, like the ducted heating or cooling air conditioner vents that were really dusty. So I took them all out.
this is a boy and had cleaned them the whole time he'd lived there.
Yeah.
Yeah.
Yeah, period. So I like took them all out and like started scrubbing them in hot water and bleach. And I was like standing over this hot sink with like the bleach fumes just like blowing into my face and I passed out. I started to feel sick and so I turned around and leant against the sink and then the next thing I know, I'm on the floor with his dad leaning over me going, oh my God, like... And the two hired cleaners, which we also had, standing over me with their mops going, fuck. Anyway,
Gassed yourself.
I did. Crazy. Don't do that. Don't add bleach hot water because apparently that makes mustard gas or some shit.
It does.
Does it?
Put bleach in cold
I
water.
mustard gassed myself. I'm lucky I'm not dead. That's crazy. Maybe that explains the mental issues.
Maybe.
Probs.
It's definitely not the trauma. It's definitely that.
Yeah.
Yeah.
It's the mustard gas. Period. We should look up side effects of mustard gas after this. Anyway. All right. I had a manic guy on a psych hold who eloped, which is like absconded.
Okay.
It's American speak for absconded. Anyway,
Yeah.
he didn't get married.
He yeeted.
Yeah. He ran like a gazelle out to the triage, barefoot in only his underwear.
Yeah, the tracks, to be honest.
Nice. Once there, he stopped and weighed himself in triage.
Priorities.
Yep. Let me see how much I've lost real quick. Anyway, then, faced with his choice of 2 convenient doors out to the lobby, he insisted climbing up onto the counter and through the little triage window, ran outside, still barefoot, and stole a police car. End of story. One comment, stop and weigh himself? Like, in his flight for freedom, he spotted a weighing scales and thought, well, before I go.
I also want to know what everyone was doing in the fact that they couldn't stop him.
Crazy.
While he was weighing himself.
Maybe they were just, oh, yeah, not sure.
He would have had to stop.
Yeah, and pause. Maybe they hadn't noticed that he was absconding at that
Didn't
point.
notice the naked man at triage. The almost naked man
I
at
mean,
triage.
it's a chaotic environment. People are busy.
It's not the first time it's happened.
And then they respond to that comment. They're like, apparently he read the number. I hadn't caught up to the chase posse until he was climbing through that window with his unnecessary Spider-Man skills, so I didn't see it. But yes, true mania and psychosis lead to people making very impulsive decisions that look obviously ridiculous to well people. He wasn't an arsehole, he was unwell. That behaviour made it look for a minute like we might be able to talk him down instead of trying for the takedown. It amuses me that the technical description for this kind of behaviour is flight of ideas, and when I first read your comment, that's what I thought you were referencing. But no, he just perfectly demonstrated the disease process. His mind flew from one topic to another. Yeah.
Yeah. It's all the scales. I must weigh myself.
Yep.
And then I need to get out.
Oh, there's a scale. I'm going to get on it. It's like ADHD. It's like, oh,
It really
distraction.
Surprise, mine's behaving itself today.
Are you medicated?
No.
Same, babe.
Not even diagnosed, but I know.
Same. All right. My cousin is a nurse at a hospital that provides the medical care for a major city's inmate population. Her first week there, she was going to give a prisoner some kind of vaccination. The deputy guarding the door opened it for her to find that the inmate was gone. After a little bit of sleuthing, they saw the drop ceiling tiles wiggling a little bit. She said she stepped back and 2 deputies and a police officer grabbed brooms and mops from the janitor's closet and started jabbing up into the ceiling until the escapee fell out head first onto one of the deputies. She said they both ended up with a concussion that she had to treat. Crazy.
That's wild.
In my grad year, we treated prisoners in the operating room.
I mean, they need healthcare.
Oh,
They're
of course, and they're entitled to that.
Exactly.
But the hospital that I was in was where all the prisoners went.
That's fair.
Because it was like a mental health, drug and alcohol focused
Fair. So
facility.
it was the most
and
appropriate
they
place.
took all of the homeless catchment as well.
Oh, lovely.
Yeah, so we got a lot of different characters coming in. Lots of code greys.
Yeah.
A lot
You
of
would.
code greys. Yeah, some people just didn't want to be treated, but they were under the Mental Health Act.
So, yeah.
Yep.
Happens a lot.
Does.
We have
Lots
a
of
lot of that too.
suicide attempts too, like cutting of wrists and things that need to be repaired. And pretty
Sad, but I'm
brutal.
glad they're getting the love they need.
Yeah. Hopefully they're doing well.
I hope so
But
too.
it's hard. It's a hard gig. I
Would
once
be.
had a guy who had to cut all the way up his arm from the wrist all the way up. Like he really had a good go at it. Not across, but like along the length of the arm. And when I checked him in, he was just, you know how they talk about having a blunted expression when they're really, really depressed or whatever. He just had no emotion.
Yeah.
He had no feeling. He was just sitting there like,
Whatever.
it was really sad. It was horrible.
There'd probably be a lot of turnover in that job because it's so confronting.
Yeah, maybe.
Hard. I don't know.
Possibly. I think you have to be a special kind of person to deal with
think so.
mental health patients.
Mad
for sure.
respect. I do it a little bit in my job.
You would always, yeah.
Yeah. And I wish I had more training than I do. Mm-hmm. But like mad respect to people that work in psychiatric facilities, mental health wards,
For sure.
the CAT teams that do that regularly, daily,
For sure.
all day, every day. Mad respect. Couldn't do it. Respect what they do.
Okay, this person says, a nurse friend of mine just dodged 2 rocks thrown at her last weekend from a patient who pulled them out of her vagina. When asked why she had rocks in her vagina, the patient said, it's her purse. Her coin purse, except make it rocks.
I mean, look.
One comment's like, even with answers, I'm still left with questions.
So many.
I'm going to assume the Ginny purse wasn't the reason she was in the hospital. A Ginny purse.
Ginny purse.
That's a new one. I'm going to refer to my pussy
You
as a
want to
Ginny
get your
purse.
rocks off?
Come over to my Ginny purse. All right. I think we'll finish on this one because we've been recording for a long ass time.
Fair enough.
Okay. I once took care of someone who's registered with a complaint of suspected latex allergic reaction. This happens periodically and for whatever reason seems to more often present with lips and tongue symptoms after a condom was used using oral sex. However, it must have not been bad because the nurse didn't signal to me that this patient needed to be seen ahead of the others waiting. If you are waiting in the ED, that's a good thing. It means the nurses think you're less sick. Eventually, I work my way through to her and enter the room to see a woman sleeping peacefully covered with a man's jacket. While the man stands against the far wall, she wakes easily. Examining her, she's clearly not having hives or anaphylaxis or contact allergy, but she does have odd, fine, flat red rash around her eyes and upper cheeks. They are very hesitant about explaining what was going on. They nearly always are. But it eventually comes out that they had vaginal intercourse with a condom, then removed the condom, and she gave him oral sex. Then she went to the bathroom and saw the rash. This wasn't making sense. It wasn't an infection or abrasion or an allergy. In fact, the rash looked petechial, which means tiny burst blood vessels under the skin. Imagine 200 tiny red freckles around the eyes. Will heal perfectly without intervention in only a few days, easily concealed with makeup until healed. Most commonly seen in patients who have repeated forceful vomiting or coughing, such as food poisoning, alcohol overdose, whooping cough. In patients without forceful vomiting or coughing, this rash is sometimes seen scattered more broadly across the body, and in that case needs serious workup because it can indicate a variety of serious things. But in this case, in this small area, after sex, I just told them that this is a rash pattern I see in kids after coughing so hard they break little blood vessels, and showed them some Google images, and then they admitted to having some consensual but quite vigorous forceful oral sex with gagging.
There it is.
There it is. So I told them that's okay, but dial it back 10% in the future. They looked at opposite corners of the room and I knew there would never be another date between the two of them.
No, they were done.
Gagging kink. And that is the end of our insane ED fucking horror stories and funny stories. What did you think?
That's pretty good.
Did that track? As
It
to
did.
the culture of ED?
We don't see as much butt stuff as we had today, but
Yep.
we do see it.
There was one actually that I have to read out.
Yeah.
It's a really small one. Under the tell me your funny ED stories, it literally just says 5 dominoes in the penis. He lived.
In the penis, wow.
Wow. Imagine. That is how?
How?
How do you get that up
It's hard
your
enough getting a
urethra?
catheter in there.
Surely there's some sort of makeshift funnel. I don't know. I can't work this out, but he didn't give any more details.
You know, pry that open like tweezers, like, I don't know, like clamps, pry it open. I don't know.
I watched this thing on TikTok where they're like little plastic ball things that they open up with like a claw thing, and then they put like the they put things in.
Yep.
Do you know what I'm talking about?
I do.
Yeah, like so they make like this squishy toys or whatever, and they have this claw thing that opens up like that. That's what I'm envisioning.
No, I'm there now.
Trauma though, urethral trauma.
For sure.
Imagine
Homeboy's giving me having
Permanent
hematuria for
damage.
days.
permanent damage.
You're supposed to put things in there.
There is a urethral sounding kink though, where they put sounds in. We have them actually in urology to dilate the urethra. They're like long instruments that sort of gradually get bigger in diameter.
Okay.
And they start with the small end and then like pop it in, and then it kind of dilates the urethra.
Makes sense.
For like strictures and shit.
Yeah.
Yeah, but people buy them for their kinks as well.
I mean, I'm not judging. You do
Sounding
whatever you
kink.
need to get off. You do your babes.
Yeah, just I mean,
I don't have a penis.
it's going
That's
to
not a
cause
big problem.
damage.
but-
Just know you're not going to come out of that without some urethral strictures.
No.
Minimum.
Minimum. Yeah.
Anyway, we might have to make a part 2.
We might have to. There's so many stories.
There's so many stories. Reddit is a wealth of ED chaos, which we love, and we're grateful because we wouldn't have had an episode without Reddit. So thank you, Reddit.
Thanks, Reddit.
On that note,
I'm a baby nurse. I don't have enough stories yet.
that's all right. There's plenty of time in your career to
so
accumulate
many.
some nursing nightmare fuels.
That's so fun.
I'm sure you have them, but you've probably blocked them out, babe.
Probably. I was literally saying to Olivia, because I was texting her on my way in, I was like, I have the worst memory.
Yeah.
I was waiting to be... Because I just block it out. I'm just like, I
That's
just
what
go about my day.
When you said that, I was like, she definitely has a story. She
Yeah.
just doesn't know it yet.
Yeah.
I will draw it out of her with my
It'll
story.
come back. The birth story is stuck with me. Like, I don't think I'm ever going to forget that.
Yeah, that's wild. That's great.
That's going to stick with me.
I love
I
that
have
story.
one more story that I think will stick with me. But it's just my job. I just come in, I do my job, I go home, turn
And I
off,
forget
it's
about it.
gone. Yeah,
Yeah.
like, I'm done.
You just brain dump.
Honestly,
Yeah, that's a coping mechanism.
just get rid of it. Go
That's
home
a-
and go to
that's a
sleep. Especially because I'm on
trauma
night shift at the
response.
moment. So I just
Yeah,
go home.
true.
I'm unconscious for the next 10 hours.
Yeah.
Wake up and go back to work.
Fatigue ruins your memory, so it's like.
It really does. No.
Anyway, thank you so much for coming in.
Thanks
and
for
saving
having
my
me.
ass, Kay. Where can everyone find you?
I'm at KBellXO on almost all socials.
All platforms.
So KAYBELLE.
I saw you making some content before, doing your little diary thing.
I did. Was
it scrapbooking?
it
Or
was a wreck this journal.
Okay.
So
Well,
it's-
explain to the listeners what a Wreck-It journal is.
So it's a journal that essentially you wreck it. So each page is like instructions on how to wreck it. It's like you stick things in here, rip this page out. One of them was make a paper airplane out of this page.
Okay.
One of them is throw it from a height, throw it in the bathtub, or like literally to wreck the journal.
Okay, it's like one of those damage rooms where you go in.
Yeah.
Wait, I think I'm saying that wrong. But like it's like a room where you go
Yeah,
into.
you go and you break all the plates and like beat up a TV. Yeah.
Like, low key, I want to try that.
Me too, actually. We should do that.
Wow, it's a date.
Yeah.
It's cathartic.
I think I did 5 or 6 days in a row and then the ADHD's.
Yeah.
I forgot about it.
Yeah.
And then I've moved house and it's been like a year.
Yep, your hyper-focus is just like
gone.
moved on to something else.
No, literally.
What are you hyper-focusing on at the minute?
I don't know. Not
Nothing?
really anything. No,
Nothing. It'll come.
It will. I think I'm just on like a little break and then
Yeah.
I'll have another hyper-focusing thing.
True,
I was
true.
crocheting for a bit there. I'm not doing that anymore. But I have half a project sitting in a bag, like waiting to be finished.
Nice.
Yeah.
Love it. All right, cool. Well, send us in your nursing nightmare feels. If you've got any horror stories for any department, please do at nurseratchetpodcast@gmail.com. Follow the Instagram, Nurse Ratchet Podcast on Instagram, and we'll take a little picture and post it on Insta for this one because the subject matter is not, maybe I could find
an X-ray.
X-rays.
Yeah. Find an X-ray of a butt thing.
Find some fucking butt X-rays.
They'll be out there.
That's what we're doing.
Yep.
Foreign bodies and a picture. Okay.
Sounds good.
Signing out. Thank you so much.
Thanks for having me.
Okay, bye.
Bye.